This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today we're going to talk about what happens when knee arthritis goes untreated. So the short answer is it will just continue to hurt, but it's not something that should preclude you from getting a joint replacement later on. So what exactly is knee arthritis? It just means that, well, with arthritis of any joint, is that between the two joints is a thick layer, depending on where it is, of cartilage. And it's kind of glistening. If you looked at a chicken bone when you're breaking it apart, that's that white glistening part, that's the cartilage. And that makes it frictionless, essentially. So when you get arthritis, that cartilage starts wearing away, and the bones will actually start touching each other. And that's when you have bone-on-bone arthritis, which is usually painful, but not always. We don't really know what exactly causes that. It's thought to be some wear and tear, some genetic component. But as we learn more about arthritis, it also seems to be that there's an inflammatory component as well, which I think we'll probably discover more as time goes on. Anyways, if you don't treat knee arthritis, it's just you're still going to have arthritis. And it's nothing that a joint replacement can't fix, because when you have a joint replacement, you're essentially cutting off the ends of the knee and replacing it with metal components, with a plastic piece in the middle, usually. They can correct for a fair amount of deformity. The only time where if you let your arthritis get really bad where it would be a problem is if your legs start bowing in or out a lot. Then you may get past the bounds of what a knee replacement can successfully fix, because there's a certain amount of angulation a knee replacement can fix. That being said, there's other options such as tibial osteotomies, but you really don't want to do that. So if you leave your knee arthritis alone, as long as you don't have any sort of leg deformity and you can live with it, usually it doesn't really matter. I mean, you can still get a joint replacement. The other thing that people sometimes say is that because your knee is hurting on one side, you start favoring the other side, and it can accelerate degenerative changes either in the hip or on the same side, or the knee or hip on the other side. And I think there's some truth to that. I don't think we have great data to show exactly how that goes. I mean, if you got knee arthritis on one side for no particular reason, it just may have been genetic or a combination of the above mentioned factors, where you were going to get on the other side regardless. Was that accelerated by the extra pain on one side? It's just hard to say, but it's a thought. Most people end up getting joint replacements when they just can't live with the pain anymore and they can't do their activities they like to do. But by and large, if it's not bothering you terribly and you don't have any sort of significant knee deformity, meaning that it's bowed in or out significantly, you really can leave it alone until you can't live with it anymore. At that point, you can start getting treatment with steroid injections, and when that stops working, then you can get a knee replacement, which usually 4 out of 5 people really end up liking, which is good. It's bad that it's not 100, but that's just kind of the nature of knee replacements. So I hope I was able to answer your question about what happens if you let knee arthritis go untreated. If you have any questions that I didn't answer, feel free to leave them below and I'll do my best to respond. If you like this video, we put out new content every Friday, so please like and subscribe, and thanks for watching.